If you're waking up 2, 3, or even 4 times every night to use the bathroom, you already know how exhausting it is. The broken sleep leaves you dragging through the next day, foggy and frustrated. For people with diabetes, nighttime urination, technically called nocturia, is frustratingly common. Research shows that diabetes increases the risk of nocturia by about 50%. Today we're going to discuss why this happens, what's really driving those nighttime bathroom trips, and most importantly, what you can actually do about it, including some surprising connections to vitamin status that most people don't realize. Before we dive in, I need to be clear that this information is educational and not a substitute for medical advice. Always consult your healthcare provider before making changes to your diabetes management, diet, or supplement routine. Your doctor knows your complete health picture and can guide you safely. Let's start by understanding what's actually happening in your body when you wake up multiple times to urinate. For people with diabetes, there are several different mechanisms at play, and identifying which one affects you is key to finding solutions that actually work. The most direct cause of nighttime urination in diabetes is simply elevated blood sugar. When blood glucose levels are high, your body tries to get rid of excess glucose through urine. Your kidneys filter your blood constantly, and when they detect too much sugar, they work to excrete it. This process pulls water along with the sugar, creating larger volumes of urine. The kidneys produce extra urine to get the sugar out, and when the extra sugar and fluids reach your bladder, you have to pee more. This is why one of the classic early signs of undiagnosed diabetes is frequent urination, including at night. If your diabetes isn't well controlled, this mechanism continues even after diagnosis. Polyuria, the medical term for excessive urination, typically occurs when blood sugars are extremely elevated. The good news is that when blood sugar control improves, this type of nighttime urination often decreases significantly. However, blood sugar isn't the whole story. Many people with reasonably controlled diabetes still experience bothersome nocturia. Research has found that nighttime urine production in people with type 2 diabetes may also be related to obstructive sleep apnea, which is much more common in people with diabetes than in the general population. Sleep apnea causes repeated breathing pauses during sleep, which triggers hormonal responses that increase urine production. If you snore loudly, wake up gasping, or your partner notices you stop breathing during sleep, this could be contributing to your nighttime bathroom trips. Another factor is diabetic bladder dysfunction. Long-term elevated blood sugar can damage the nerves that control bladder function, a condition called diabetic cytopathy. This can affect your bladder in two opposite ways. Some people lose the sensation that their bladder is full, so they don't empty completely, and then need to go again soon. Others develop an overactive bladder where the muscle contracts too frequently, creating urgent needs to urinate even when the bladder isn't very full. Kidney damage from diabetes, called diabetic nephropathy, can also contribute. As kidney function declines, the kidneys lose their ability to concentrate urine properly, meaning your body produces more dilute urine throughout the day and night. Additionally, many people with diabetes take medications that affect fluid balance. Diuretics for blood pressure, certain diabetes medications, and even some supplements can increase urination. Now let's discuss something that often gets overlooked, the role of vitamin status in bladder health and function. This is where things get interesting because vitamin deficiencies are remarkably common in people with diabetes, and emerging research suggests these deficiencies might contribute to urinary symptoms, including nocturia. Let's start with vitamin D, which has received considerable attention in bladder research. Vitamin D receptors are present throughout the urinary tract, including in the bladder muscle, the lining of the bladder, and even in prostate tissue in men. Vitamin D receptors have been found in muscular layers of the bladder wall, the tissue lining, prostate, and pelvic floor muscles. When vitamin D levels are low, bladder function can be affected. A comprehensive analysis of multiple studies found that vitamin D deficiency increases the risk of overactive bladder and urinary incontinence. The mechanisms aren't completely understood, but vitamin D appears to influence how bladder muscle contracts and relaxes. Studies have shown that vitamin D deficiency can lead to overactive bladder symptoms, including increased urinary frequency and urgency. More directly relevant to diabetes, a study in postmenopausal women found that taking high-dose vitamin D supplementation for 8 weeks significantly reduced both the severity of urge incontinence and the frequency of nocturia. Before treatment, over 70% of participants reported high impact from urinary symptoms on daily life. After vitamin D treatment, that impact was significantly reduced. However, I need to be honest about the limitations. A large prevention trial in men found that vitamin D supplementation at 2000 IU daily was not associated with decreased prevalence of urinary incontinence or overactive bladder symptoms, though there was a borderline significant benefit in men who started with low vitamin D levels. The research is mixed, which tells us vitamin D isn't a magic cure, but optimizing your vitamin D status might help, especially if you're deficient. Vitamin D also plays an important role in blood sugar control itself. Studies have found associations between low vitamin D levels and poorer glucose management in people with diabetes. By supporting better blood sugar control, adequate vitamin D might indirectly help reduce glucose-driven urination. Additionally, vitamin D influences immune function, which matters because people with diabetes are more prone to urinary tract infections that can worsen nighttime urination. For people with diabetes, the typical recommendation is to have your vitamin D level checked through a blood test. If you're deficient, defined as levels below 30 nanograms per milliliter, your doctor might recommend supplementation. Therapeutic doses used in research range from 1,000 to 4,000 IU daily for maintenance, with higher loading doses sometimes used initially for severe deficiency. These decisions should always be made with medical supervision. B vitamins also deserve attention, particularly vitamin B12 and B6, though their connection to nocturia is less direct. These vitamins are crucial for nerve health, and diabetic nerve damage can affect bladder function. Vitamin B12 deficiency is extremely common in people taking metformin, the most widely prescribed diabetes medication. Over time, metformin interferes with B12 absorption, and deficiency can worsen nerve problems, including those affecting bladder control. Vitamin B6 plays a role in neurotransmitter production and nerve function. Some research suggests B6 may influence fluid balance and kidney function, though more studies are needed specifically on its effects on nocturia. What's clear is that maintaining adequate B vitamin status supports overall nerve health, which indirectly supports normal bladder function. The key point here is that vitamin supplementation isn't a standalone solution for nocturia. Think of it as one piece of a comprehensive approach. Optimizing your vitamin status might help reduce symptoms, especially if you have deficiencies, but it needs to be combined with other strategies. So what else should you be doing to manage nighttime urination? The foundation is always blood sugar control. Monitor your glucose regularly and work with your healthcare team to optimize your diabetes management. If your overnight blood sugars are consistently elevated, that's likely a major contributor to your nocturia. Better control often leads to fewer nighttime bathroom trips. Pay attention to your fluid intake timing. Most of your daily fluids should be consumed earlier in the day. Try to limit fluid intake for 2 to 3 hours before bedtime. This doesn't mean becoming dehydrated, it means shifting when you drink. Make sure you're getting adequate hydration throughout the day so you're not desperately thirsty at night. Avoid bladder irritants in the evening. Caffeine and alcohol both increase urine production and can irritate the bladder. If you're drinking coffee or tea in the afternoon or evening, try cutting back or switching to decaffeinated versions. Alcohol has a diuretic effect and also impairs sleep quality, compounding the problem. Consider your medication timing. If you take diuretics for blood pressure or heart failure, talk to your doctor about whether taking them earlier in the day might help. Never adjust medication timing without medical guidance, as this affects more than just urination. Empty your bladder completely before bed. Take your time, don't rush. Some people benefit from double voiding, urinating, waiting a few minutes, then trying again to ensure complete emptying. This can reduce the likelihood of waking soon after falling asleep. Elevate your legs in the evening. This sounds odd, but it can help. Throughout the day, especially if you're sitting a lot, fluid accumulates in your legs. When you lie down at night, that fluid redistributes and your kidneys process it, creating more urine. By elevating your legs for an hour or two before bed while sitting, you can encourage this fluid redistribution to happen while you're still awake. If you're overweight, weight loss often helps. Excess weight increases pressure on the bladder and is strongly associated with sleep apnea, both of which contribute to nocturia. Even modest weight loss can make a meaningful difference. Get evaluated for sleep apnea if you have risk factors. This includes loud snoring, observed breathing pauses during sleep, excessive daytime sleepiness, or a thick neck. Treatment for sleep apnea, typically with a CPAP machine, often reduces nighttime urination, along with providing numerous other health benefits. Pelvic floor exercises, sometimes called Kegel exercises, can strengthen the muscles that support bladder control. These aren't just for women, men can benefit too. Ask your doctor or a physical therapist specializing in pelvic health for guidance on proper technique. Some people find bladder retraining helpful. This involves gradually extending the time between bathroom trips during the day to increase bladder capacity and reduce urgency. This should be done under medical guidance, especially if you have diabetic nerve damage affecting sensation. From a dietary standpoint, focus on foods that support overall health rather than expecting specific foods to solve nocturia. A diet rich in vegetables, lean proteins, healthy fats, and high-fiber foods supports better blood sugar control, which is your foundation. Some foods naturally high in water content, like many fruits and certain vegetables, are best consumed earlier in the day rather than close to bedtime. Foods rich in vitamin D include fatty fish like salmon, mackerel, and sardines, egg yolks, fortified dairy products, and fortified plant milks. However, it's difficult to get therapeutic amounts of vitamin D from food alone, especially if you're deficient. Sun exposure helps, but many people with diabetes, particularly older adults, have limited sun exposure or reduced skin production of vitamin D. For B vitamins, good sources include meat, poultry, fish, eggs, and dairy for B12, and chickpeas, poultry, fish, and fortified cereals for B6. If you're vegetarian or vegan, you'll need to be particularly careful about B12 as it's primarily found in animal foods. Fortified foods and supplements become important. Let me address some expectations. If nighttime urination is primarily driven by poor blood sugar control, improving your glucose management can lead to noticeable improvement within days to weeks. If it's related to vitamin deficiency, optimization takes longer. You might start seeing some benefit after 4 to 6 weeks of supplementation, but full effects can take 2 to 3 months. However, if nocturia is due to established diabetic nerve damage affecting bladder function, improvement may be slower and might not be complete. Nerve healing is a gradual process, and some damage may be permanent. The goal becomes preventing further deterioration and managing symptoms as best as possible. If nocturia is related to sleep apnea, treatment for that condition often produces relatively quick improvement in nighttime urination, sometimes within the first few weeks of CPAP therapy. If kidney damage is involved, the focus shifts to protecting remaining kidney function and managing fluid balance, which may involve working with a kidney specialist. Here's what I want you to understand. Waking up multiple times every night to urinate isn't something you just have to accept as part of having diabetes. Yes, it's common, but that doesn't mean it's untreatable. The key is identifying what's driving your specific situation. Is it blood sugar control, sleep apnea, nerve damage, vitamin deficiency, medication effects? Often, it's a combination of factors. Start by talking honestly with your doctor about how much this is affecting your life. Broken sleep impacts everything: your energy, your mood, your ability to manage your diabetes, even your safety if you're stumbling around in the dark. This is a legitimate medical concern that deserves attention. Ask about checking your vitamin D level, especially if you haven't had it tested recently. If you're taking metformin, ask about B12 testing. Discuss your overnight blood sugar patterns. If you have symptoms suggesting sleep apnea, ask about a sleep study. If you're experiencing other urinary symptoms like difficulty starting urination, weak stream, or feeling like you're not emptying completely, mention those too. Be prepared to track your symptoms for a week or two. Note how many times you wake to urinate, how much you drink in the evening, what your bedtime blood sugar is, and any patterns you notice. This information helps your doctor understand what's happening and tailor recommendations to your situation. Understand that solving nocturia often requires a multifaceted approach. It's not usually one simple fix. You might need to optimize blood sugar control and address vitamin deficiency, and improve sleep hygiene and adjust medication timing. Each piece contributes to the overall solution. Be patient with the process. Improvement typically happens gradually rather than overnight. Small reductions in nighttime bathroom trips, from 4 times down to 3 or 3 times down to 2, represent meaningful progress even if you're not yet sleeping through the night completely. And don't hesitate to follow up with your doctor if initial strategies aren't helping. There are medications that can help reduce nighttime urine production in some cases, bladder training programs, and specialist referrals to urologists or urogynecologists if needed. You have options beyond what we've discussed today. I'd love to hear from you in the comments. How many times are you typically waking up at night? Have you noticed any connection between your blood sugar levels and your nighttime bathroom trips? Have you had your vitamin D levels checked? Your experiences can help others watching this video who might be dealing with the same frustrating problem. If you found this information helpful, please hit that like button. It helps other people with diabetes find this content when they're searching for solutions to nighttime urination. And if you haven't subscribed to the channel, click that subscribe button and turn on notifications so you don't miss future videos about managing diabetes complications and improving your quality of life. Share this video with anyone you know who has diabetes and struggles with broken sleep from nighttime bathroom trips. Sometimes just knowing that it's a recognized complication and that there are strategies to address it can be encouraging. In my next video, I'm going to discuss another common diabetes complication that affects quality of life: persistent fatigue. We'll talk about why people with diabetes often feel exhausted, even when blood sugars seem okay, the medical causes that need to be ruled out, and practical strategies for improving energy levels. Make sure you're subscribed so you catch that one. Until then, remember that managing diabetes is about more than just blood sugar numbers. It's about quality of life, including getting the restorative sleep your body needs. Don't suffer in silence with nocturia. Talk to your healthcare team, track your symptoms, and work together to find solutions that help you sleep better and feel better. You deserve restful nights, and with the right approach, improvement is possible. Take care of yourself, and I'll see you in the next video.